Hello there, my name is Jane, and I'm here to guide you through the benefits of the Anthem Blue Cross HMO Value 80 plan offered through CalCPA ProtectPlus. Whether you're responsible for finding the most competitive healthcare plan for your organization, or you're an employee whose company is changing coverage, it's important that you understand how the different plan benefits work in order to make the best healthcare choices. CalCPA ProtectPlus is the brand name for a group of medical plans that are offered through the Group Insurance Trust of the California Society of CPAs. This group of plans includes 10 self-funded PPO plans and 2 fully insured Anthem Blue Cross HMO plans. They are the only medical plans endorsed by CalCPA. To help you through this process, I'm going to take a few minutes to walk you through the key features of the Anthem Blue Cross HMO Value 80 plan. If you'd like a complete overview of the HMO Value 80 plan, click on Watch the entire video link to the left. If you're interested in a particular topic right now, you can click from the chapter list to the left to skip ahead and watch a particular segment. Remember, if at any point you have any questions, just click on the Ask an Expert button and a ProtectPlus representative will get back to you in 2 business days or less. HMO stands for Health Maintenance Organization. When you enroll in an HMO plan, you choose a primary care physician who will be the first physician you see for all of your health care needs. If you need specialty care, you must first see your primary care physician, who will refer you to other healthcare providers. This referral structure allows for HMO plans to contain costs and to ensure that you get the appropriate level of care. The HMO plans differ from the ProtectPlus PPO plans in that they are fully insured through Anthem Blue Cross. Anthem Blue Cross determines the rates and benefits and sets the underwriting and administration policies. HMO participants are not entitled to the rights of survivorship benefits available to members of the ProtectPlus plans. Additionally, solo practitioners are not eligible to join the HMO plans. Your primary care doctor may refer you to another doctor or healthcare provider if you need special care. Your primary care doctor must okay all the care you get except for emergency services. Your doctor or medical group must agree that the service or care you get from other healthcare providers is medically necessary. If the service is approved, you will receive a referral form that you will take with you to your appointment. This form is your proof that your doctor has approved the care. If your care has not been pre-approved, you will not be covered through the plan. There are 2 ways you may get care for some special services without an okay from your primary doctor or medical group. They are direct access, which lets you get care from allergists, dermatologists, and ear, nose, and throat physicians without a referral. Or speedy referral, which allows your primary care physician to refer you to another doctor without getting an okay from your medical group first. Not all medical groups take part in these programs. Ask your doctor or call Anthem Blue Cross Customer Service to see if your medical group offers these programs and find out how they work. The HMO Value 80 plan has no annual deductible for medical services. For some services, you will pay nothing at all, and for other services, you will pay a copayment. A copayment, or copay, is the amount you pay for most medical services. All copayments apply toward the annual out-of-pocket maximum, except the copay for infertility diagnosis and testing. The copay for office visits, home health care, and physical therapy is $15. Please note that you are allowed 100 visits a year for home health care, and for physical therapy you are allowed a 60-day period of care. Visits to specialists and consultants is $30. You will pay a $100 copay for hospital emergency care visits. However, that copay will be waived if you are admitted. Sometimes you will pay a percentage of the cost of services. In some cases, your copay is expressed as a percentage of the cost of services. You will pay 20% of the charges for services such as inpatient hospital and surgical facility services, inpatient mental health and substance abuse services, and services provided in a skilled nursing home facility. You will pay 50% of the charges for diagnosis and testing for infertility. For some HMO Value 80 plan benefits, there is no charge, such as preventive care, outpatient mental health and substance abuse care, hospice care, family planning services, and in-hospital surgical and anesthesia services. You will not have to pay any more copays for the rest of the year once you reach your copay limit. The copay limit is $5,000 for one member, $10,000 per two members of the same family, and $15,000 for three or more members of the same family. You can meet the copay limit individually, or if more than one person in the family is covered, all family members can contribute towards meeting the family copay limit. The HMO Value 80 plan utilizes a formulary for prescription medication coverage. A formulary is a list of generic and brand name drugs available to you under your plan. Non-formulary drugs are also available to you, but you will pay more for these drugs. Brand name drugs, which include non-formulary drugs, are subject to a deductible of $150 per individual. The brand name deductible is in addition to the annual plan deductible. There are 3 tiers of prescription drugs. For generic drugs, you will have a $10 copay for a 30-day supply. For brand formulary, you will have a $25 copay for a 30-day supply. For brand non-formulary, you will have a $45 copay for a 30-day supply. The same copay is applied to mail-order prescription drugs, but you'll get a 60-day supply. Bear in mind that mail-order prescriptions are only available through the plan's mail-order program. Please note that you may be required to order self-injectable and other specialty drugs through a special mail-order pharmacy. As with any medication, you also can ask your physician or pharmacist if there is an equivalent generic alternative available to reduce your cost. If you use self-injectable drugs, excluding insulin, you will pay 30% of the negotiated cost of the drug. Self-injectable drugs are not covered out of network. The Patient Protection and Affordable Care Act now mandates that certain preventive care benefits are covered at 100%, but only when the services are performed in-network. These include annual physicals, well woman care, well baby care, and many other services. To see a complete list of covered preventive care services, just click on the Preventive Services link. You do not have to get a referral from your primary care doctor or medical group when you go to an Anthem Blue Cross HMO provider for counseling or treatment for mental health or substance abuse. You will need authorization from Anthem Blue Cross for inpatient mental health and substance abuse services, and also for visits beyond the first 12 visits to a doctor or a therapist in a 12-month period. You must also have pre-approval from Anthem Blue Cross to obtain treatment from non-Anthem Blue Cross providers, even if your primary care doctor and medical group have authorized it. For inpatient services, which include overnight hospital or facility stays, the plan will pay 80% of eligible charges. Remember, inpatient services must be pre-authorized by Anthem Blue Cross. For outpatient services without an overnight hospital or facility stay, the plan will pay 100% of eligible charges. You must have approval from Anthem Blue Cross for any outpatient visits after the first 12 visits in a 12-month period or year. For office visits or therapy sessions, you pay $15. If you have a specific question about the HMO Value 80 plan, visit CPA ProtectPlus.com at the link below, or contact our plan administrator at Banyan Administrators LLC, Monday through Friday from 8 a.m. until 5 p.m. at 877-480-7923. For Anthem Blue Cross customer service, call 888-209-7847 or click on the link below.